Hey, we're going to go ahead and get started. Well, thank you everyone for being here with us. Good afternoon and welcome to the second Let's Eat Healthy Community of Practice. We are thrilled you are joining us and look forward to your participation in today's webinar. My name is Sonia Fernandez Arana, and I'm the Let's Eat Healthy Program Manager with Dairy Council California. I'd like to welcome you all today. Today's webinar topic is presenting the 2024 Food and Nutrition Trends for Educators and Health Professionals. This webinar will explain Dairy Council California's trends process for how the food and nutrition trends are identified and provide an overview of the latest trends. We also have a guest speaker with us today. You will hear from the California Department of Education on the topic of artificial intelligence and the innovations impacting education, food, and nutrition. Next slide. We will be muting everyone until later when we have the discussion and networking part of our agenda. Please note if you have audio issues, please click on the arrow next to the mute button and select test speaker and microphone. Simply follow the prompts to connect to the audio. Time has been reserved at the end of both of our presentations for questions and comments. And to submit questions or comments, please chat those in the Zoom chat box at any time during the webinar, and we will address those at the appropriate time. And a link to the recording of this webinar and a copy of the presentation slides will be provided to all registered participants. And as we welcome you, our partners, we would love to know who's joining us today. So we kindly ask if you can enter your name, your agency, and title in the chat box. We'd greatly appreciate it. And for today's agenda, we will provide an overview of the community of practice and its purpose in advancing Dairy Council California's initiative, Let's Eat Healthy. Our first presenter is Megan Holdaway, registered dietitian, nutritionist, and nutrition science program manager at Dairy Council California. She'll be providing the overview of the trends. She'll also share the implications that are relevant for professionals in education, school food service, healthcare, and public health. Our second speaker is Katherine Goyette, computer science coordinator representing the Office of the Deputy Superintendent Information Technology Branch at California Department of Education. Katherine will address the multifaceted impact of artificial intelligence, really providing that foundation of its inner workings, applications, and considerations impacting education, food, and nutrition. And there will be an opportunity to connect with each other and good chance to really share your thoughts on today's webinar topic, which will be guided by a facilitated discussion. We will also spotlight resources that can continue to support exploration and learning of trends and AI. And in closing, it's important that we hear from you all, our partners, to really gather feedback on today's webinar and to also help improve future sessions, plus the opportunity to identify topics that are of interest to you for future community of practices. And for today's objectives, as I shared, we're going to provide just a really overview and review those trends and what those implications are for those various sectors. We will have the opportunity to delve further into the considerations of artificial intelligence and learn a little bit more about that. And the opportunity to come together, network, really discuss the applications of these trends and potentially the strategies to address shifts in the environment. But before I begin, I'd like to share just a really brief overview of Dairy Council California and its initiative, Let's Eat Healthy, for those that are new to engaging with us. So for over a century, Dairy Council California has collaborated alongside champions like yourself, representing diverse sectors to elevate the health of children, families, and empower healthier communities. We are a collaborative nutrition organization working under the authority of California Department of Food and Agriculture, and are funded by our California dairy community to really support nutrition in schools as well as the communities and to provide resources to professionals to educate on the positive role that dairy plays in health. And through the Let's Eat Healthy initiative, champions like you are engaged to support strategies and solutions to champion community health by supporting nutrition security and access to nutritious foods, including milk and dairy, as well as supporting equitable access to evidence-based nutrition education, all to support optimal health and well-being, and really doing so through partnerships, collaborations, and co-creations. And the purpose of the Let's Eat Healthy community practice are to bring our Let's Eat Healthy community partners and provide that platform for partners to come together, learn, network, share expertise and best practices to really support efforts and advance the collective work that is contributing to the advancement of the initiative goals, which are displayed on the slide. And without further ado, I'd like to present our first speaker, Megan Holdaway, who will provide an overview of the 2024 food and nutrition trends. As I shared earlier, Megan is a registered dietitian, and she is the Nutrition Science Program Manager at Dairy Council, where she helps guide the creation of science-based content, information, and messages. Megan also leads the coordination of the organizational trends process and the development of the nutrition science publications and reports. And lastly, Megan is a member of the Academy of Nutrition and Dietetics. I would like to remind everyone, if you have questions or comments, please feel free to chat those for the presenter anytime. Now I'd like to welcome Megan.
Great. Well, thank you so much, Sonia, and thank you for having me here today. I'm excited to be able to share a little bit about our trends process, as well as our recent trends publication for educators and health professionals. So we're going to go ahead before I get into it and start with a poll. And the question is, how familiar are you with Dairy Council of California trends? Are you familiar, somewhat familiar, or not at all familiar, but interested to learn more? Give you just a few seconds. Great. So, okay, great. We have about 60% of you are familiar, 33% are somewhat familiar, and then some are not familiar at all. So we kind of have a spectrum, but I'm excited. Hopefully everyone can take something today, some insight that they didn't have before with them today. So go ahead and advance. Thank you. So just to give a brief background, our trends process has been an integral part of our organization for almost 4 decades. And this process involves a team of staff from Dairy Council of California who we meet throughout the year to track, aggregate, and then elevate top nutrition trends to really provide a foundation for our strategic planning and knowledge and issues management. We also capture these developing shifts in a broad range of areas. So this includes the dairy and food environment, nutrition research, and advances in nutrition science, everything from that to consumer behavior. So we try to really get a scope of the environment as it relates to nutrition. And through this process, we develop 2 publications per year to distill this information for our partners in nutrition, in the healthcare settings, in the school food service environment, and our dairy community. And as well as supplying this information, we also provide implications for people and organizations to consider as they determine how to best address shifts in the environment. So today I will be sharing, again, 5 of the trends that we identified in our 2024 edition of Trends. And just to set the stage for the trends, I just want to acknowledge that we live in a complex and rapidly changing environment. We've seen challenges brought from rising rates of chronic disease to gaps in nutrition security. And alongside that, we've had major social, political, and environmental events in the past few years. So looking at it through the lens of nutrition equity, just want to highlight the importance of working together and seeking creative solutions to meet the diverse needs of people throughout all life stages, and that this is really vital for the success and health of communities both here and throughout the world. So our first trend relates to children's health. Children are facing growing physical and mental health crises that could have major implications for future health. And these challenges really require ongoing support at home, in schools, and in healthcare settings. Rising rates of childhood obesity, as we know, are linked to increased risk of developing type 2 diabetes and high blood pressure. And in the face of these rising obesity rates, research is also showing body dissatisfaction among adolescents is linked to social media use, and it's growing. Other research shows that adolescents' perceptions of themselves are kind of changing. What is a healthy weight? And kind of maybe not viewing themselves as overweight. So health professionals do continue to recommend treating obesity in children and adolescents. And this treatment is associated with the highest rates of medical spending for these age groups. And since the American Academy of Pediatrics 2019 policy statement that highlighted the need for increased access to metabolic and bariatric surgery, there has been an increase in kids' bariatric surgery overall and for each ethnic subgroup. So these examples really highlight the complexity of these topics, as well as the importance of lifestyle interventions such as nutrition education, physical activity, and mental health and wellness supports, as we see this increased need to turn to weight loss medications and surgery. Next slide. So mental health is also increasingly viewed as a defining public issue.
Can I use your headphones, maybe?
For the current generation of youth. The American Medical Association adopted a policy that really recognizes children's mental health, and the barriers to care that many children experience. The US Surgeon General identified some of the following as reasons for this mental health crisis. There's loneliness and isolation, lack of engagement with the community, and then global challenges from gun violence to increased climate change disasters, racism, political polarization, and then of course, economic instability. And these impacts are different for kids, but when the pandemic hit, we saw a greater impact on females aged 13 to 18 compared to their male counterparts at the onset of the pandemic. And then I also wanted to highlight the research that looked at over 63,000 children from throughout 16 countries, and it found that 22% of children and adolescents showed signs of disordered eating, with a higher proportion among girls and those with the higher BMI. And so disordered eating can include some of the symptoms that are present in eating disorders, both of which are strongly correlated with mental health. And this really highlights that interrelated nature of mental and physical health. So what are the implications that we see for this trend? First, understanding and meeting the physical, social, and emotional needs of children is imperative. And across the different settings, whether you're in schools or whether you're in healthcare, health professionals particularly can continue to improve access to nutritious food and physical activity before other interventions, providing education and referrals as needed. And then in the school setting, addressing lifestyle changes, food access, and nutrition education can really help improve eating patterns. And then our second trend relates to population changes. So it's important to recognize the demographic shifts that we're seeing both in California and throughout the world. Recent data that is highlighted here on screen shows that the number of births in California declined 26% between 2007 and 2021. Education enrollment continues to decline throughout the US, where 12% of elementary schools and 9% of middle schools saw at least a one-fifth of their enrollment decline over a 4-year period. And California has the largest number of schools where enrollment loss hit at least 20%. This is partially due to the size of the state, but also due to some of those factors such as a declining birth rate and a limited housing market in some areas. So thousands of schools as a result are at risk of closing due to enrollment loss. And this is also impacting the higher education system. The California State University system saw a 6.5% drop in the number of new enrollment since 2019. And then we're also seeing an increase in the number of enrollees at vocational schools. So really just these impacts for demographic shifts we'll continue to see those in the school settings. Another significant demographic shift is that the trend of the aging population that was long predicted, it's now here, and the US Census Bureau reporting that the number of people aged 65 and older will reach 80.8 million by 2040, and this is up from 54.1 million in 2019. And the 85 and older population is projected to more than double by 2040. You can see on the screen some data that's specific to California. What are the impacts of an aging population? Looking at the workforce, an older workforce could lead to higher labor costs, for example, through salaries, health insurance, and other benefits, while companies might be kind of looking at how they can rethink benefits packages to hire and retain staff. On the consumer side, companies are evolving. We're already seeing this evolution happening where they're seeking to meet the needs of this changing population. So one multinational corporation is pivoting from a foundational product in some of its markets, which is baby formula, and creating products that appeal to older adults, such as protein drinks and heart-healthy foods. So we'll keep seeing these shifts over time. And then looking closely at the aging population and their health, there are projections that more than 24 million adults in the US will need long-term care by 2030, which isn't very far away, which is double the current need. And then most adults, older adults, have at least one chronic health condition. So high health care costs and lack of access could really make it harder for older adults to receive the care that they need in those advanced stages of life. Nutrition, as we know, plays a key role in managing disease and quality of life. We've seen some exciting research coming out about the association between dairy intake and risk of dementia in older adults, which found that compared to non-consumers of milk, people who drank milk 1 to 2 times per month showed a lower risk of incident dementia, and also that daily yogurt consumers had a reduced risk for dementia, and that yogurt intake might be inversely associated with dementia risk. And then overall, looking at all of the evidence, dietary patterns with a higher variety may reduce the risk of dementia in older adults. So we'll keep seeing more research on this important life stage and follow those advances as well. So a few of the implications for this trend: declining enrollment and fewer students will impact everything in the school environment. This will be from the number of school closures, as it was mentioned, to class sizes and food procurement. So we'll keep seeing those impacts on schools. Businesses will, as was mentioned, consider shifting demographics, and will need to keep considering those as they develop long-term strategies for success and financial stability. And then finally, with the older adults, as the population increases, we'll need to keep looking for those nutrition solutions that include access to and education on a variety of foods, including dairy, and the role that they play in supporting community health. And then our third trend is related to sustainability. This topic is at the forefront of food conversations, with organizations and individuals really striving to make a positive impact on the planet through their food choices. School meals are one commonly discussed vehicle for implementing sustainability practices. And then on a more global level, we've seen last year at the UN Climate Conference, where 2/3 of the estimated 250,000 meals that were served were vegan and vegetarian. And then here in California, we have the Farm to School movement, which is growing, and the CDFA will be awarding up to $52.8 million through its Farm to School Incubator Grant Program in 2024 to 25. And the goals of this are to increase the availability of local foods, to increase marketing opportunities for farmers, and to really strengthen children's knowledge of the rich agricultural sector in California. And so while sustainability practices such as reducing waste and adopting plant-rich diets are growing, there is some evidence that consumers' attitudes and behaviors towards sustainable diets, that there are some mixed messages and maybe some confusion about meanings and terminology, and really how do these different choices we're making impact the environment. So we're going to keep seeing state, national, and global efforts to shape perceptions of what it means to eat sustainably, as well as create environments that promote and prioritize sustainability. Survey findings show that 1 in 2 people consider adopting sustainable foods as more of a priority than saving money. However, personal choices without the support of those policies, systems, and environments are hard to change, and consumers in practice still prioritize price and taste when purchasing food. And then sustainability labeling. This is another growing area in need of guidelines to avoid consumer confusion and greenwashing. So increasingly, we'll need to ensure that nutrition education integrates the whole sustainability nutrition story so that we can keep reducing those barriers and disparities in food access and support a rich food economy and culture for everyone. So the implications for this trend are that consumers want to choose sustainable food options, but there is confusion sometimes about how to do so. So as we keep seeing policy evolve, ongoing consumer education will really be a critical first step in understanding how personal choices impact the environment. Sustainability conversations and actions must address the intersecting challenges of the climate, food insecurity, and food systems, and recognizing that there's not a one-size-fits-all approach to healthy eating patterns to suit the needs of a diverse population. And finally, improving people's access to nutrient-dense, affordable foods is imperative, and dairy foods really support nutrition security as they provide a unique package of nutrients to meet the needs of a growing population. And then our fourth trend is related to whole dairy. Whole milk and dairy foods continue to show positive impacts on health, from the gut microbiome and nutrition security to overall health. So looking at the science, we see advancing research really validating the benefits of full-fat dairy and its positive impact on chronic disease, that eating patterns that are high in fruits, vegetables, legumes, nuts, fish, and whole-fat dairy have been associated with reduced risk of cardiovascular disease. This is especially true in places where consumption is typically low. And also seen evidence that foods like cheese have been linked to lower risks of dying from all-cause heart disease and stroke, and is not associated with obesity. On the policy side, this research is really catalyzing initiatives such as the Whole Milk for Healthy Kids Act, which would allow whole milk to be served in schools. And this is still in the legislative process, but we're continuing to track this. And then as far as consumption of whole-fat dairy, such as cheese, yogurt, and butter, is on the rise due to shifting values and perception, as well as this research and innovation in the dairy industry. So we'll continue to see a positive role for whole dairy foods within those cultural eating patterns. And then I wanted to just touch briefly on food as medicine interventions. These are increasingly seen as an important solution to improving nutrition security and addressing health inequities that are often seen in under-resourced communities. So this pyramid that's depicted on the screen highlights the range of food as medicine interventions that are currently in place. And dairy foods play an important role in the federal nutrition security programs on the second rung, which is things like WIC and SNAP and school meal programs, which are key to this food as medicine framework. We've also seen the National School Lunch Program really helping to improve diet quality and food security, and possibly even academic performance. And excited to see the adoption of universal meal programs that began in California and has happened in a few other states. And the ongoing expansion of these food as medicine programs, such as medically tailored meals and produce prescriptions, will really help give people access to more nutrient-dense foods to support their individual health needs. And then as far as the implications for this trend, we see credible science and a renewed value for whole dairy foods that may shift dietary recommendations to include a wider variety of dairy options that can meet personal preferences and health needs. Health educators really play a key role in educating people on the health benefits of whole dairy foods, and they can also advocate for the inclusion of whole milk, cheese, and yogurt within nutrition security programs. And there's just more opportunity for whole dairy foods to be incorporated in culturally relevant eating patterns as people continue to eat more at home and really embrace their cultural food traditions. And then before I get into the last trend, we have one more quick poll question, and that is, are you using artificial intelligence in your work? So yes, no, or maybe you're not so sure. All right, here we go. Okay, 39% of you say yes, 50% say no, and then 11% are not sure. So I'm probably in that last category too. If you could advance the slide. Our last trend is related to artificial intelligence. And I'm not going to go too much into this because we have a great presentation coming with Katherine on artificial intelligence, but the healthcare and education sectors are really adapting to these rapid advances in artificial intelligence technology as governments and institutions kind of are working to develop guidelines for its implementation. So AI is not new. This is, but it really has become part of the conversation as we've seen new technologies come out. And it's a topic of increasing interest and a growing need for us to kind of understand its relevance to our work and how we can implement it. So the education field is adapting to challenges and potential of AI. We saw the launch of ChatGPT, which brought fears of plagiarism and cheating, but those fears kind of are subsiding as educators become comfortable with using these applications. We saw survey data that found that out of the 2,000 people surveyed, about a third of students were using ChatGPT and 51% of teachers reported using ChatGPT. This is for everything from lesson planning and generating ideas to building background knowledge of a topic. And overall, people reported having a positive impact. And then as far as the healthcare industry, maybe slower to adopt as far as the patient-doctor-physician interaction, but 10% of professionals reported using AI technology, with more than 50% planning to use it in the future. And this is for everything from appointment setting and medical research to even potentially diagnosis and treatment. And then as far as nutrition professionals, AI applications can support the creation of tailored meal plans and notes and health education materials. Though it's really important still to continue to weigh the risks of issues such as patient privacy and information accuracy. So people, as you can see on the screen, kind of have mixed feelings about physicians using it. So 60% of Americans would be uncomfortable with providers relying on AI in their own healthcare. And then less than half in the US expect AI in health and medicine to improve health outcomes. So there's a growing need for regulation across all sectors. Just to briefly touch on a few, the US Department of Education making recommendations, the American Medical Association creating a framework for AI implementation, the National Academy of Medicine launching a project to develop a healthcare artificial intelligence code of conduct. And then in California, with Governor Gavin Newsom signing an executive order to kind of prepare California for progress of AI as a state with leading academic institutions and companies. It's really important that the state remains a leader in AI. And then I'm going to finish with these implications, which are that industries are really in the early stages of combining human intelligence with AI. So really looking at ways to effectively use AI in healthcare and education settings will be essential. And then, we need to continue training and testing so that we can avoid misinterpreting science and misguiding the public in the process. So thank you everyone for your time with these trends. This was a quick overview, but I'm going to hand it back to Sonia for the next portion of our presentation.
Thank you so much, Megan. We appreciate you providing an overview of Dairy Council's trends process and really sharing the nutrition science findings with us. For the interest of time, we will reserve questions for Megan at the conclusion of today's presentations, but you can enter questions or comments in the chat. Our next presenter is Katherine Goyette. As I shared earlier, she is the Computer Science Coordinator representing the Office of the Deputy Superintendent, Information Technology Branch for CDE, where she supports educators in implementing computer science, artificial intelligence, and STEAM. Katherine is an author, learner, and educational leader who advocates for inclusive educational opportunities for all students within the communities they reside. Katherine was primary writer for California's inaugural computer science standards. She has been a keynote speaker, featured presenter, and panelist for organizations across the globe on various educational topics. I'd like to welcome Katherine.
Thank you so much. It's a pleasure to be with all of you. I'm going to go ahead and share my screen now. And let me put it in present mode. All right. Excellent. I am going to open the chat as well, so feel free to interact in that way if you would like. And we are going to look at one of the trends that Megan spoke about, artificial intelligence, and how that is shaping the future of food, nutrition, and education. By the way, this image on the left was created by AI. So, all right, these also were created by AI. So I decided to ask some AI image generators, what do you think when I put in the term artificial intelligence? So these are the different ones I use: Gemini, Adobe Firefly, and Canva. And you can see this interesting intersection of technology and humanesque, right? Not a real human. So what does that mean? What is AI? And so IBM says artificial intelligence leverages computers and machines to mimic problem solving and decision-making capabilities of the human mind. So how does it do that is the next question. And is that something that we want or don't want, right? So we're going to talk a little bit about that. But first, I want to show you something. This is called Quick Draw. It's available on Google. It's like a Pictionary game. And so please don't judge me harshly. I used my trackpad on this video on my computer, but it asked me to draw an ambulance. And you could see at the bottom, it thought it was a foot, shoe, glasses, fire truck, school bus, not sure what it is. Finally, oh, I know it's ambulance. So how does the AI know what this is? Because it's not programmed to know exactly my picture and then tell me what it is based on that. So how does that work? So it is because of all the input that has been given over the years. There's 50 million drawings and counting. So just to understand that when we're using AI, it's based on all of this data, and the AI is making a prediction as to what seems to make the most sense. And it wants to make you happy. So sometimes if you use ChatGPT, it will make things up because it wants to make you happy. That is something that happens. So be careful. All right. So again, really important that we kind of understand that AI isn't magic. There's training input that is put in, then new inputs help it to continue to learn. And then it's not magic inside the hat. It's actually math. It's actually prediction. And then there is an output based on that. So I just wanted to start kind of with that context before we move forward, as I think it will help us to better understand some of what we're talking about. So I decided I'm going to use ChatGPT. And if you haven't used ChatGPT, as you can see, it's a chatbot. I ask it a question and it gives me an answer. The better the question, the better the answer, the more input that you put in there, because it doesn't have the context of knowing who you are and what you really want. And there is a free version that you don't have to sign in on anymore also. That just came out last month. So that's ChatGPT. And all of these references to any tools that I'm using are going to be available to you later as well. So I asked, can you create a healthy plan for me? Now, ChatGPT was pretty smart because it said, that's not enough info. Give me more information. So I answered those questions. And it gave me some answers. So vegetable omelet, I would love that every morning, but I don't want to spend the time to make it. Fruit and nut butter, quinoa salad, Greek yogurt alternative. That's because I said I was lactose intolerant. So, it does a pretty good job, right, at doing these things. So this is one way that we can use it, is by asking it to help us ideate on things that we may not have thought of before. In education, I don't know if any of you were in high school in the 90s like I was, but I used WordPerfect. Did anyone use WordPerfect back in the day? And it had, essentially, it was like Grammarly, and it would show me, I learned how to change my writing from passive to active voice. I remember this. Like, I remember this was a thing. And so often we hear teachers with great intentions saying like, well, oh, Sonia used it. Awesome. Well, are the kids just going to use this generative AI to cheat? Because you can say, write me a 5-paragraph essay, and it's going to do so. And that is a valid concern. We have to rethink how we get to know what our students' writing looks like. We have to think of perhaps different ways to assess them. But there's ways we can use this to help with student writing as well. So I just put in a blog post that I wrote a few years ago and asked ChatGPT to describe my style, tone, strengths as a writer, and opportunities for growth. And so it gave me some things there. So at CDE, we really are seeing that, yes, ChatGPT, that's what's on everyone's mind, and we address that, but there's more than that, and there's more things for us to consider in our society. So here is an example. This is actually AI voice typing in Google Docs. Anything that is voice recognition is actually utilizing AI technology. When you search in Google, that is actually AI technology, right? Maybe not quite as complex, but as some of our generative systems, but it's the same type of technology in that it's making those predictions. And so this is a way that, we definitely could see this used for some of our students. There's some pretty cool tools. When Megan was talking about mental health concerns, I thought about students that get overwhelmed. They may have ADHD and have trouble breaking things down. They might have anxiety. And so this is a tool, goblin.tools, that helps you if you say, I need to write a research paper about the benefits and limitations of AI in education. It tells you some different steps to take. So AI certainly can be helpful. All right, well, what about in the food world? Has anybody been refrigerator shopping lately? So if you have, you may have noticed that there are pretty expensive refrigerators that will, based on the items in your refrigerator, it will provide you with recipes of what you can make. So is that something that could potentially help us, that could potentially help us have less food waste, that makes things a little bit easier for us? We get to try some new recipes. Super cool. Oh, Andrea, a washing machine with AI. Oh, tell me more about that. That I have not seen. That sounds fascinating. Yeah, that's fascinating. It's going to be everywhere. The other thing, I have not experienced this myself, but drive-throughs, fast food drive-throughs are starting to use chatbots, but of course verbal, to at the drive-through to take your order. And so it's interesting to think about, what is that? Is that a good thing? Is that a bad thing? We could debate it for a long time. But there are things we have to think about. Is this going to be biased against people with a non-standard American accent, right? Or is it going to, there could be various biases that could come out of this. So we just have to kind of think about those things. All right, Andrea says the washing machine has AI on the dial. Okay, maybe it guesses like what based on what's in the washer, it probably guesses what kind of what type of how it should run or something. Yeah, senses the load. Nice, nice. So also in food and nutrition, we know that there's some fascinating things happening, because what AI does is it takes all of this data. It takes all of this data and it comes to conclusions, makes predictions based on this data. So in whether that's in the medical field, and it's looking at scans of millions of scans of various X-rays, and then determines what it predicts might be the challenge, right? Based on all that data. In this particular example, in this UC San Diego article, an AI platform was developed to address food deserts in low-income communities. So what it did was took all the data of these food deserts and what the needs were, and connected businesses that wanted to support that wanted to bring in some affordable food options for those areas. So that's a pretty cool use. I don't know if you've seen anything like this, but when I was in Vegas last year, I saw that I could order a drink at one of these little kiosks, and a robot would mix it for me. Not sure how you all feel about that, if you think that's a good thing or a bad thing or whatever. Again, we could debate it. There's certainly both sides, but these things are coming, right? They're already here, I should say. So at the Department of Education, we came out with AI guidance in September 2023, and we were the second state in the nation to do so. We have a resource kit that just came out this week as well. So we believe that it's important. AI is here. So we do want our students and educators to learn with AI, but also learn about AI so they understand the risks. So safe use is important. Leveraging the pros and cons, social impacts, all sorts of things we want to think about. The interesting thing is, in our schools with our students, do they understand that how AI works, and that it's not always 100% accurate? Or so my favorite part of that is how very calmly the AI says, make a U-turn. Has no idea that these people just drove into a lake. And so the reason I show that is because we have to understand that the AI is not human. It doesn't have the context. It doesn't have a conscience. It doesn't understand the human experience. And so we have to take it with a grain of salt, utilize it, absolutely, but we have to critique the inaccuracies. I'm here at a conference today, and Dr. Sophia Noble from UCLA was here. She wrote a book called Algorithms of Oppression, and she was saying that more than 50% of what comes back on ChatGPT is inaccurate. I thought, wow, that's fascinating. That is a huge number, right? So yes, utilize these tools, but again, make sure that you are critical thinkers about it. In regards to safe use, also super important. So I saw, this is a Taco Bell, not one I had been to, but they have the drive-through chatbot type ordering, drive-through AI takes your order, and it says your orders may be recorded and your voice may be digitally translated. So this actually says so, right? But have you ever noticed how, like, on your phone, you're talking to your friend or your family member about something, and then all of a sudden you have Facebook posts like advertising those things? Like, a lot of these things are already occurring. We just clicked, yes, I accept the terms of agreement. We don't always think about them. And so it's just something that we have to always be careful of. In a school system, please, I welcome and encourage you to utilize these tools, these generative tools. However, we want to make sure that we're not putting any personally identifiable information of ourselves or students into these tools. We need to make sure that we check the output and make sure there's no biases, make sure there's no, there's no sources that were made up, because it'll do that, right? So I did ask ChatGPT if it was collecting information about me and who they share it with. And it said, I don't have access to personal data about individuals. And this is my favorite part, unless it's been shared with me during our conversation. I was like, you're sneaky, ChatGPT. You're trying to act like you're not taking my information, but you are. So again, just things to think about anytime you're utilizing any of these tools, and especially as they come into the world, and I know they're going to they're here, that they're not going away. I used to get my news when I was in elementary school. I read the actual paper, like actual paper. Any of you that are my age know about the silly putty that you'd put on the newspaper, and then it would show that, oh, no one knows. I see someone nodding. Anyway, now I get my news on my Google News app. Well, what I've noticed is it just gives me what I've clicked on. So I know a lot about Disney parks. I know a lot about technology. I don't know much about sports. I don't know, there's certain things in the world that maybe I don't know unless I go to something that I didn't sign into, right? That knows my preferences. And so that's something that we want to be thinking about. If you are signed into Google and you just click on to search, it's going to guess what it thinks that you are wanting to search. That's great. That's cool. It's like Netflix, like telling me what I want, guessing what I want, but that also means that it's collecting all this data. So something that you want to be thinking about. The social impacts of AI are also something that we want to consider. There's some scary AI out there. There are deep fakes that kids have made. And so they'll put an inappropriate video or image, and then they'll put a classmate's, they'll superimpose a classmate's face on it or something like that. So that, we've got to be aware of these things so we can start to really focus on the digital citizenship aspect. Anybody looking for a girlfriend? Because you can get an AI one, apparently. So these are things. Is it good or bad? We could debate this as well. There are chatbots available even on there's AI on Snapchat now, I guess. And so our young people, and probably even some of our elementary students, older elementary students, they have access to these chatbots that they talk to as if they're people. And so something that we really want to think about, could that negatively impact their mental health, right? Something we need to think about. All right. I thought this was pretty cool. This was at CES, the Consumer Electronics Show. I think that's what it stands for. I could be wrong. And it has a food scanner to track nutritional values, which I thought was pretty cool. What are your thoughts on that? On this new technology that's coming out? How might it be helpful? What might be some risks? Is it all good? Anyone have any ideas? I think it's kind of exciting. I like data, so I think that's kind of cool.
Hi, Catherine. I agree. I
And-
think it's exciting. And of course, I'm a dietitian too, so I'm cautious, about how accurate it would be.
Mhm.
But in the future, just I could see it could be, like they said, really helpful for diabetics, especially like type 1 in children as well, if you're eating out
Yeah.
at a restaurant. But yeah, I just like how accurate is it really?
Yeah, exactly. That's the thing, is the accuracy. You'd have to check on that. Which with everything, right? With all of these things. Absolutely. It will be interesting to see what comes out in the future as well. I did want to share kind of what's happening at the national and state level, so that you're aware also. And so I think, and let's see, I'm seeing in the chat here, I think people just know to eat mostly veggies and fruits, throw in a little dairy, do not like the dependence and not have the knowledge in your head. Yeah, that's a good point. And that's something that a lot of people are talking about is, do our students and our adults even know enough to be critical of the AI? Like, are they going to become so dependent that they don't even know when it's wrong? And so that's, I think, where education comes into play for sure. And for all of you, like that's why it's important to make sure that our students are well aware of nutrition so that they don't go into these AI systems and just believe it, right? So absolutely. So in October 2023, the White House AI Bill of Rights came out. The CDE AI guidance had come out in September, and there's a lot of parallels. So the White House AI Bill of Rights talks about safe and effective systems. We talk about safe use as well, and data privacy. They talk about algorithmic discrimination protections, and we definitely want to recognize there may be bias in systems. That's something we want our educators and students to be aware of. Notice and explanation, making sure that we understand how these things work, and then human alternatives, consideration, and fallback. So that's something that we really emphasize in that guidance is understanding that these are not human, and that human connection, especially with our mental health crisis, our youth mental health crisis, that human connection is key. So if there's an AI that's going to replace a connection with a teacher, I don't want it. It should only enhance that. If it enhances it because it gives the teacher more time to be with students, awesome. If it enhances it because it provides the teacher with great data to know how to provide an in-person lesson to a small group, awesome. So the other thing was and I think Megan mentioned this, the California Generative AI report was released in November 2023. And so there's some parallels there as well. The fact that there are capabilities and risks of Gen AI, discussing some beneficial use cases is something that we want to start working on. And then, of course, we want those ethical use policies and guidelines, understand the risks, and training the workforce. So, all right. Oh, thanks, Sonia, for the clarification there. This is the information about some one-pagers that are about that California guidance. This will all be provided to you. So you'll be good to go as far as that goes if you wanted to look through it further. But again, this top part, utilizing AI in schools is something that we support as long as it's done safely within data privacy protections, et cetera. And then developing AI in schools, we want them to really understand how it works. So, looks like we might even have some time for questions. This is a picture of my daughter. She is in a Tesla. It's not real, so it's not actual AI, but there it is anyway. And so at the moment, we live in an area that's relatively rural. I don't know if they're teaching about AI in those schools. I don't know if they are teaching her to be a critical consumer when she goes to kindergarten. So something that we want to think about for ourselves and for those we serve. So I'd love to open it up to questions. I'm hoping you don't hear that noise, but you may. Apologies if so. I'll go ahead and stop sharing, and if there's any, I'll watch the chat to see if there's any questions.
Yeah, thank you so much, Katherine, for providing a very thought-provoking presentation and sharing some examples of those rapid advancements of AI. Very interesting to see all the various applications and the different sectors in which we're seeing that. I do have a question. I'm so happy that you kind of closed out today with that thought of what does this mean for the future and really our students? So my question is, what AI skills might be essential for students in the future?
Well, that's a great question. I think one is So some people say that prompt engineering is important so that you are able to ask the AI in detail what you want and get a better response. While that is true now, the AI systems are going to get so good that that might not be as necessary. And so I think the biggest, most important thing is that our students start to understand that this is all based on data, and that we have to be critical of that data because that data may be biased. That data may have inaccuracies. And so that critical literacy piece, I think, is the biggest, the most important thing in all of this, as well as like, what are the social impacts of this? What, are we going to have more facial recognition, which is going to be problematic or helpful, right? Like there's all these things that we can talk about. Heather says, what has the response been from teachers and students when teachers started using AI to generate lesson plans? So when teachers learn they can use AI to help them with lesson plans, what I've seen is they love it because it saves them time. I think the challenge has been, unless they don't like understand how to prompt it properly, and then they just say, well, this is junk, I'm just going to do my own, which is fine too. I think for students, when they find out their teachers are using AI, they say, why can't I use it? So that's why it's really important for our teachers and students to talk about this, to have those conversations together. In the classroom, if I had high schoolers, I would probably say, all right, this particular assignment, you are not allowed to use AI because this is the learning objective. Where as opposed to like this other assignment where, hey, that's fine if you use it, but I want to see a screenshot of what you did. I want to see how it helped you to come up with a different, to make your writing better or whatever it may be. Great question.
We can give it a few more seconds. I know Katherine does need to jump out at 2, but if there are any other questions that do come up between now and the time that we close, don't worry, I'll go ahead and share those with Katherine, and we'll be able to provide a response for you. So thank you, Katherine, for continuing to, support this group and share your expertise with us. I'll give it a second. So you're welcome to unmute yourself or drop that in the chat.
Katherine, just another quick question. It's Maria again. I keep thinking about the food scanner, and I'm just so excited about it because I remember like doing outpatient nutrition education and counseling, and patients with multiple chronic diseases, it can be difficult for them to grasp what foods to eat. And so I was just kind of curious, and you probably said it and I missed it, but I was just wondering if you knew what company is creating that. Like, is it a healthcare related company?
I don't
Okay.
know. But the video will be sent with all of the resources,
Okay,
the YouTube video. So yeah, I don't know. I would imagine it's probably pretty expensive now. I hope it goes.
Yeah.
That's just my guess. Hopefully it'll go down in price as well.
Yeah.
If students are allowed to use AI for reports and a fair percentage of the encodes are inaccurate, they won't have the basic foundation knowledge. So how will the testing of their knowledge be accurate? Yeah, that's absolutely true. So, well, 2 things. If the info is inaccurate, like as a teacher, you're probably going to notice that. So now you're going to have a conversation with them. Absolutely. But that's why the importance is on teaching the students how to really, how to notice that, because they don't realize that there's that much inaccuracy. So absolutely. I think also, Sonia, that also though speaks to the point that educators need to be careful using AI as well. They need to use their subject matter expertise to make sure that there's no errors in something that was AI generated. I've done that. I've created AI generated quizzes, and then I go back and I usually have to change some things because it didn't know, and that's fine, but it gave me a start.
Well, thank you so much, Katherine. We sincerely appreciate you coming on and really sharing your knowledge on this topic. And We wish you could stay for the breakout session, but we know you need to jet off for the conference. So thank you again, and
Thank
we'll
you.
happily share your contact information with the
Please
group so
do.
they can continue to reach out and ask questions or learn more. But thank you so much
Thank you.
for your time. Okay, we hope you guys enjoyed. Oh, I'm sorry. I did want to stop and ask if there were questions for Megan. I apologize. But there will be an opportunity also following the breakout session if there are questions. So I can just take a moment. Seeing anything in the chat. But Megan, if there is something that pops up, we'll make sure that we share that with you.
Yeah,
So for
sounds
the
good.
Wonderful. For the next part of the webinar, we really want to be able to provide the opportunity for those that are attending today to kind of come together and have some facilitated discussion. And the purpose is really for us to kind of reflect, really think about the content, the trends, as well as, the applications of AI and, that Katherine presented with us, and really lean in on our experiences. What have we seen? How these different trends have really impacted the environment in which you're engaging with, but also where there's some opportunities to really think about how can we create solutions to better support the various different works that you're doing and the target audiences that you're engaging with. So we do have about 10 minutes for the breakout. I want to thank our Dairy Council of California staff who are going to support with facilitating the discussion. And as you go into your assigned room, think about which trend resonated with you the most and why. Or, if you want to continue talking about, AI, that's okay. So, Bailey, if you can break us off, that would be wonderful. Thank you so much. Say hi, welcome back, everyone. We hope you enjoy the opportunity to kind of delve a little bit more into the trends or a trend. And we'd love to hear a little bit of just, what was discussed within your group. So if every facilitator can kind of just share maybe 1 or 2 takeaways, that would be great. We could start with group number 1. Sure, who was group number 1?
I don't.
I think we were group number 1.
Do you know who facilitated?
Did we have a facilitator?
It was Raj, I think.
Okay.
We just had like an informal conversation, but we talked about the trends. The first one, the students with the physical and the mental health, that resonated with a lot of us. The whole AI one at the very end was also interesting, and we're like looking at the accuracy of the mixed foods on that machine. That seemed really interesting. So it was just like a discussion of the trends. But the 2 that we talked about a lot was the physical and the mental health one with the students, and then looking at the AI for like looking at the nutritional. And then we also kind of touched on disparities too, because it's like if some segment of the population will have access to some of this new technology, but some of it won't. And how does that kind of play out? If anybody else wants to add more from group 1.
Yeah, that was a great overview. I was thinking too, we talked a little about like kind of the intersection between a lot of these trends, how they like you have the aging population and workforce changes and new technology, and how does it all kind of fit together? So it's kind of interesting to just think about how they all, what the implications will be.
Group 2, I see some overlap here of what was discussed. Maria was our wonderful facilitator.
Oh, exactly what Sonia said. Those were the 2 big trends that we were talking about as well, the mental health and the youth. And we were talking a lot about girls before hitting that puberty age and just their physical image, mental health, how you get them to eat healthfully in an age, where we're hearing how kids, they're skipping meals at school. They don't want to eat. They want to be thin. And so just making sure they're getting that education being eating healthfully at school and probably at home too. And we also talked a lot about AI, especially AI in schools. Gail brought up how their Long Beach State, right? They're coming up with a generic statement on AI for the dietetic interns, like they can't use it, but so schools they're needing to put in their policies about the use of AI, and so how that's going to affect everybody.
Yeah, Gail, would you like to add anything to that in terms of, what's happening, at the university level?
Since we came out of our group, what occurred to me, we could ask AI to define a healthy snack for a certain age group of a young girl and or a young boy, and go through all the age groups and see if just to see what's generated, and maybe see what baseline, what information it has, like if it would go to My Plate, or if it would go to RDAs, or if it would go to food groups, or the pyramid, which there's still a lot, I'm sure, of pyramid information out there that AI would use versus the plate. So I think it's the intertwining of, again, the mixture of those, but I do think we still can't eliminate the importance of how we communicate with each of these age segments in our population. The pregnant mom, the teen, looking at the child, the parent of the child and the infant, and the onset of foods, and the nutrition counseling then for the young adult, the pregnant wife, the young couple, the athlete, athletics that didn't come up. I think it's mentioned when I've read the whole document, it does mention, but sports nutrition is so big. And so nutrition in that field and the communicating a message, as well as our professional staff, anyone who's professional and works, and then the use of fast foods and packaged foods and how to make sure those are healthy and the quickness, but then our seniors and our chronic disease. And nowadays, and this year for clinical case studies, as we close on the whole year of internship, we haven't for years had a case study where there's one single diagnosis of a patient. And so what does that mean? That means any of the management for eating has to look at multiple issues. Is it blood sugar? Is it the sodium level, blood pressure? Is it the lipid aspect? And so will AI be able to generate accurately that multiple need when we, the individual and the professional, have to be able to do such? And that could be something to think about on the planning for seniors. You can no longer give planning, it's a rare senior, older adult. It's a rare older adult to just have to monitor one thing or be concerned about one thing in their eating pattern.
Yeah, that's really interesting to think about, nutrition being more than just a generated list of things that you should consume or not consume, but really that individual approach and the lifespan approach, really looking, for each person, but then where they are in life and what their multiple disease states might be or not. So yeah, I don't know. Will AI ever be able to do that? It'll be interesting to see.
They're integrating lots of information now to come up with reports. When they tie it down, we saw that example, tie it down with subtopics. And the more you clean that out, hopefully the more accurate the information. But it means what was fed into the computer has to be accurate.
Didn't Katherine say, or was it you making that Chat GPT, it's only 50% accurate? I was like, that's not a lot.
Yeah, I recently had an experience with it generating citations and they were not accurate. And so it's kind of like, it's given me, I hadn't seen that before. I was like, oh, okay, that definitely, it can't do everything.
Exactly, yeah.
Right.
Katherine mentioned earlier, you could limit the pool of info. So you could say using such and such data, what would you say? And that's what they're doing in the classrooms. They're limiting. You can set it up so it limits what sources the students can look at. I don't think she had time to say that.
And then the prompt engineering, I'm not as familiar with that term, but I like it. It sounds very fancy for how you ask the computer or something.
Yes. Was there third group, Bailey. I'm not, okay, yeah. It seems like most of us were accounted for within the groups, but that's okay. We do have some resources just to kind of close out today. The first one, of course, if you want to learn more about the trends that Megan presented on, we'll provide a link to this landing page where you can access the latest publication, but also stay up to date with the future publications as well. These are produced quarterly, I believe, Megan, but please correct me if I'm wrong. But if you're on our listserv, we will make sure that we get this out to you. But if you are interested in doing a little bit more of a deeper dive on the trends, the latest trends, the report's there for you. The second resource is Let's Eat Healthy Toolkit. And this is a resource that's provided by Dairy Council California as well. This is also a co-created resource with some of our Let's Eat Healthy partners. And it's a curated guide for really professionals that are working together to empower, healthy eating. So the toolkit provides these kind of guided call to actions, or these are just, suggested activities, as well as supportive, credible resources that are structured around 4 steps, which are learn, educate, advocate, and collaborate. And these are all contributing to the advancement of the initiative, Let's Eat Healthy. And one of the suggested actions is really encouraging professionals to stay informed on the latest trends, but also how can we invite future professionals, for example, as DI students, to really understand what are these trends, what are the implications of me as a future professional as they start to kind of enter this workforce, really think about that and what's happening within the environment. And I believe those are the resources. We will share Katherine's resources as well. She did share that there is a newly launched AI toolkit, I believe. So that will be provided in all the various resources that she shared with us. So, and lastly, we would love to, kind of hear feedback from you. So there is a QR code. We can spend just, 1 or 2 minutes at the very end to complete the survey. So we are currently doing a call out to our partners. If there's a specific topic or best practice you would like us to incorporate for our next series of community of practices that will be starting at the new school year, please share your thoughts with us, We'd also want to learn, the value that these community of practices are providing you as well. There will be a certificate of attendance. There is one that is specifically for school nutrition professionals, noting the professional standard codes. And there's also a general certificate of attendance. And those will be accessible as a download selection after completing the survey. So we could definitely spend some time. Bailey, would you like to kind of advance to the next slide just to kind of showcase? Yes, thank you, Bailey. So this is kind of what the certificate will look like. If you are experiencing difficulty, please reach out to us and we can get you that certificate. But thank you, Bailey, for also dropping the link in the chat. And contact information for both Megan and Katherine, as well as myself, are on this slide, but it will also be shared out as part of the resource list. So, and a copy of the slides, both ours and Katherine's, and a copy of the recording as well. I'd like to thank you all, as well as, for your time, but really thank our speakers and our staff facilitators. So we look forward to your participation next year when we launch our fall community practice.